Hello, CANdid Connection. Happy October. It is Breast Cancer Awareness Month that I'm sure we're all aware of. We're going to see pink everywhere from a lot of different companies. But obviously, it's just important to remember what this month means. And so ACS Can, we're very excited for our guests on this month's podcast. So continue watching. You'll get some good information from people who took time to be part of this podcast because it can get very, very busy for the experts that we had during the month of October for them. So please enjoy. So just a little bit of what we have going on here this month at ACS Can. It is October, so the month before the election on November 8th. So we have the Senate up, the House up, all statewide officials are up. So that's taking up a lot of their time. So session is at recess, both at the federal and at the state level. And so they're out there working. So go out, feel free to find the candidates that are running and ask them what their stance is on the issues that matter to you, and make good choices for the election coming up. So we are gearing up to have a whole new crop of legislators. Obviously people are termed out, so you're always going to have new people coming in serving the state and the House. And we're going to educate them on ACS Can's issues. And a big issue that we have coming up is tobacco funding for prevention and cessation programs. Michigan is unfortunately one of the top states in the country for a number of people who smoke and who obviously get cancer from smoking. So we're hoping that the state can do better as a whole to prevent some people from starting smoking or stopping smoking, quitting if you currently are a smoker. So we have other issues that we're obviously going to continue fighting for, like oral chemo parity in the state. We know that is an issue that Michigan has worked on for many, many years. We're hoping that we can finally get it across the finish line soon. So basically, if you are looking to get involved, if there's something that you are passionate about, interested on, please just shoot me an email at molly.maidenblick@cancer.org. And I'll get you in touch with the right people, or if I am that right person, then I'm happy to talk with you more about any issues that we have going on and how we can get more involved with that. So like I said, we have a great show coming up this month. So stay tuned and enjoy everything that we have put together for you. Thanks, everyone.
To possibilities that once seemed impossible. To strength you didn't know you had. To understandings that reshape everything. Cancer is a beginning. Because we believe your greatest tomorrow is ahead of you.
Molly Maidenblick. It is the beginning of October, so that is Breast Cancer Awareness Month. So there's obviously a lot of stuff that is happening this month, and we're very, very excited to have our guest, Dr. Ashley Richardson, with us today. She is a breast cancer surgeon. She's also an adjunct faculty at Michigan State University, an associate professor at Wayne State University, and she has her office that she practices out of in Flint and in Clarkson. And so I would like to welcome our guest today. Hello, Dr. Richardson. Thank you for being with us.
Hi, Molly. Thanks for having me.
Yeah, of course. So as I said, it is October, so it's Breast Cancer Awareness Month. And so the American Cancer Society, our Cancer Statistics Center, estimated in 2022 that invasive breast cancer will be newly diagnosed in an estimated 287,850 women. And so these rates have been increasing by about 0.5% per year since the mid 2000s. So I was just wondering if there's, can you talk a little bit about why these rates seem to be trending upward?
Sure. And you're correct. They have been trending upwards. And one of the things that we know is the population is also getting older. So advanced age, as you get older, the risk of cancer goes up, and that certainly follows trend with breast cancer. So as the population continues to age, the risk of breast cancer actually goes up. And that's a lot of patients do not know that. And when I mention to the patients that the older they get, the risk goes up, they're often surprised by that. They think they get to a certain age and that risk actually goes down, but in actuality, the risk is higher. So as the population ages, the breast cancer risk goes up as well. We also know that there's a large obesity epidemic in America, and with obesity also comes an increased risk of breast cancer. So there have been a lot of us working to help impact that epidemic because the risk of cancer, a lot of different cancers, including breast cancer, go up with obesity. We also know substance abuse, which continues to be a problem in America. So tobacco and alcohol both can increase your risk for breast cancer. So those are other things that we continue to see increase the trend for breast cancer, as well as reproductive health and other factors that tend to trend into that elevated risk.
Sure. Well, there's a few things that you mentioned in there that we can, a lot of people think, oh, cancer just kind of happens sometimes. But if you have a healthy lifestyle, if you're, not smoking, drinking, or excessive, that, it's nice to know that these things can actually help reduce the risk of cancer, breast cancer. So.
Yeah, we call those modifiable risk factors. So there are certain things that we can't modify, right? So I can't change my genes. I can't change that I was born genetically female and my breast cancer risk is higher in females. So those are non-modifiable risk factors, but certain things that are modifiable, such as the obesity or our weight, substance abuse, not smoking, not drinking, things that we can change on our own, living a healthy, active lifestyle. And I'll counsel my patients frequently about things that they can try and change on their own, especially patients that have been diagnosed with breast cancer. They'll come to the office and say, what can I do? How can I decrease my risk? Or what can I do going forward to decrease the risk of recurrence? And we spend a lot of time talking about diet and exercise and activity. And I think a key point is to understand that you can be as healthy as possible. I'll see vegan marathon runners and they'll still get breast cancer. I will see that are overweight and diabetic, and they may never get breast cancer. So there's no perfect solution, but trying to do the things innate to yourself that you can change are important. And it gives the patients a little bit of control of how can I be active in either my recovery, my risk of recurrence, or my prevention.
Yeah, absolutely. So you kind of talked a little bit about this, but can you kind of elaborate a little bit on what are some of the common risk factors for breast cancer?
Common risk factors. So I always tell ladies being female, getting older and having breasts, right? Those are three very big risk factors. And oftentimes those are things that we can't really change. Keeping in mind that 1% of breast cancer are in males. So males get breast cancer as well. So they are certainly not immune to this. And I think that's a key thing to remember as far as men checking their breasts or being aware of any lumps or changes, because that risk factor is there also. And sometimes in Breast Cancer Awareness Month, we leave out the men.
It's easy to do that for sure.
Too, because it is out there, and being aware of your body, male or female, is certainly important. But other risk factors, like we had touched on, obesity, any type of substance abuse, so whether it be alcohol or smoking, and it's really hard to hone in on what's acceptable when it comes to those substances. I'll have patients say, well, can I have a glass of wine, or can I do this? And I think the big thing that I touch on is things in moderation. And we know things that in excess, whether it be fat content or alcohol or tobacco, are not good for you. Other modifiable risk factors that we briefly touched on as well, as far as reproductive history, the exposure to estrogen and hormone replacement therapy. That's a big topic that we have in the office for ladies that have been on hormone replacement therapy for an extended period of time, can also increase their risk factors. Obviously, one of the things you can't change is genetics, and in the office we often do genetic testing, and that's non-modifiable. But knowing ahead of time if you have a genetic mutation or being aware of your family history is certainly important, because that can drastically impact how we treat you and what we look for.
Modifiable and non-modifiable. I'm gonna have to start using this. I think that's a better way of how I've been kind of stumbling over it when I talk about it. So as we know, early detection is usually very important in treating cancer. So is this true for breast cancer as well, to make sure that we detect it early on?
Absolutely. I talk to all of my patients about knowing your own body. I always say, you know yourself better than I do. So if you see something that's new or changing, certainly bring it to my attention. That comes with a monthly self-breast exam. And there's a lot of back and forth out there. If you look online, who should be doing a breast exam, who shouldn't. But from the American Cancer Society perspective and the American Society of Breast Surgeons, we certainly recommend doing a monthly self breast exam. Things that are new or changing and persistent. And that's a key word, because if something comes about during a menstrual cycle and goes away, that's less likely to be a concern. But if something comes about and stays and is very persistent, then that's more concerning as a provider and needs to be brought to our attention. And so the more that you know you're normal and things that need to be addressed, the better.
So what are some of these signs and symptoms that people should be aware of?
Signs and symptoms to look for in the breast: any new palpable lump, so any mass or lump or anything that you feel that's suspicious. In a younger person, that could be a cyst or something not cancerous, but it's very difficult to know that, so it should all be brought to the attention to your doctor. I always tell my patients as well to look in the mirror. So if you look in the mirror, and I know it's difficult for all of us, but if you get out of the shower and turn and look in the mirror, if all of a sudden you see an inverted nipple, so the nipple's going inward, it's deviating to one side or the other, you lift up your arm and there's a big divot in the breast, those are certainly things that are a change and need to be brought to your doctor's attention. Breast redness or breast swelling, if one breast is much larger than the other, and anything that's new or changing kind of overnight. If you were breastfeeding and after you finish breastfeeding, the nipple kind of stays tucked in, that might not be a concern. But if you're just kind of living your daily life and you look down and all of a sudden the nipple's starting to go inward, that's an acute change, and that could be a clinically concerning problem.
Okay. So what does the screening process look like if you're not at home and you would go into a doctor's office for that screening? What does that look like?
So for the average risk population female, you're going to be recommended for a mammogram to begin at age 40. So
Okay.
average risks are those that do not have an extensive family history of breast cancer or a first degree relative with breast cancer at a very early age. So for the most part, the general population will be recommended for a mammogram to begin at age 40. There's also a lot of data out there in the news, and a hot topic right now, especially this month, about breast ultrasound. Oftentimes, ultrasound can be used in addition to mammogram, given dense breasts or other specific findings on a mammogram, but the standard of care is to always start with a mammogram. Other modalities that we tend to incorporate is a breast MRI. That's a little bit more down the road of high risk screening. So it's not typical for the general population, but it's also an imaging modality that we'll incorporate when it comes to breast cancer or preventative medicine for breast care.
Okay. So change the topic a little bit here. So I hear that you're presenting at the All Cancer Symposium. So I was wondering if you could maybe tell us a little bit about that event and maybe what you'll be presenting on.
Sure. Yeah. In the Breast Cancer Awareness Month, we get tugged and pulled in lots of different directions, and it's a hot topic. So the All Cancer Symposium is being presented through Carmanos. It's on October 16th. I'm sorry, October 15th. I will be there on time, I promise. And we're asking all patients and breast cancer survivors and patients and anybody interested in the event to register by Tuesday, October 12th at carmanos.org/cancer symposium. All are welcome. And I'll be speaking on the topic of breast cancer and breast care, kind of embracing the future. So looking back at where breast cancer care was as to where we're going in the future relative to clinical trials, the latest and greatest as far as surgical options and reconstruction, all things related to the future of breast care.
Great. Well, it sounds like it'll be a good event. And so, as you said, I'm sure you and a lot of other doctors are being pulled every which way, especially in October. So we do really appreciate you being here with us today. So for our listeners, where could they go to find more information on breast cancer and on Carmanos?
So www.carmanos.org is a great website where they can reach out for breast cancer information, and as well as to find breast cancer providers, whether it be surgery, medical oncology, radiation oncology. Your whole spectrum of providers can be found at carmanos.org. You can also call 1-800-CARMANOS.
Wonderful. All right. Well, I think those are all the questions I had for you today. Like I said, we just really, really appreciate you being here and bringing attention to this and for the work that you do. And so good luck on October 15th with the symposium. We appreciate it.
Well, thank you very much. Thank you for having me.
Of course. Bye-bye.
Bye.
Also, we are very happy to have our guests today, both with the Cancer Prevention and Control section within the Department of Health and Human Services here in the state of Michigan. So please welcome, we have EJ Siegel and Robin Roberts. Let's add them both here. Hello to both of you. Thank you for joining us today.
Yeah, you're welcome.
Um,
Glad to be here.
Great. All right. Well, Robin, let's start with you if you don't mind. Can you tell us a little bit about maybe what your title is and what you do within your section in the department?
Yeah, I'm the manager of the Services Coordination Unit, and within that unit, we have three different programs related to cancer screening. We've got the Breast and Cervical Cancer Control Navigation Program, the Wise Woman Program, and the Colorectal Cancer Control Program. And I have been with the cancer section now for about 21 years, I believe, and I just really like the work that we do here. So
Great.
That's about it.
Thank you. Wonderful. EJ, how about you?
Yep. Hi, and I'm EJ Siegel. I am the program director for the Breast and Cervical Cancer Control Navigation Program. And actually, I've been with the state for 23 years. I am a nurse, so I started as a nurse consultant in the program for the first, I think about 16 years. And then after that, I've been the program director. My background is in oncology nursing. So I am certified through the Oncology Nursing Society as a certified oncology nurse and also a breast care nurse. And breast cancer and cervical cancer are just my life with this program. I just so enjoy this program.
Sure. Well, thank you both again. As per usual, I usually learn a lot myself on these podcasts, but I'm excited to learn along with you because Robin, I have met you before, but EJ, I haven't met you before. So I didn't know all of that in your background. So that's wonderful. So thank you both again very, very much. So I'll kind of direct this question at to both of you. So maybe I'll let you fight over who kind of wants to take it. But for those listening, what are some of the programs that the state provides for free cancer screenings?
Yeah, we don't need to fight. EJ is the expert on the breast and cervical program. So
that's very nice of you, Robin.
Actually, not a whole lot of programs. The main one is our program, and that's the Breast and Cervical Cancer Navigation Program. And we provide free breast and cervical screening services. So we provide mammograms and pap smears to women and it depends on the age, exactly what you would be eligible for. From women 40 to 64, we will provide mammograms for them free of charge, as well as any diagnostic follow-up procedure she may need if that mammogram is abnormal. For women 21 to 64, we provide pap test and also any follow-up they may need for an abnormal pap test. And then one other thing in the program that's very dear to me is for women that are under 40, we don't provide screening services, but if they have a breast problem, like if it's a young woman in her 20s or 30s and she feels a breast lump, we can see her in the program if she's age and income eligible. We serve low-income uninsured women. And by this is uninsured or underinsured. Uninsured women obviously have no insurance. Underinsured are women who have insurance, but they may have a high deductible. And we don't define what that deductible would be. I mean, to some women, $100 is a lot, and it would mean they won't get their diagnostic services. So their screening services are paid for through their insurance, but not the diagnostics. So if they're at 250% of poverty, which to give you an idea for a family of two is probably $45,700, they would be eligible then for the program. One big thing with the program is people always ask, well, what if I'm diagnosed with cancer? The program itself cannot pay for cancer, but we do have a special Medicaid program that the woman may be eligible for. And this is different than regular Medicaid, because if the woman meets our income guidelines, then we can probably get her on our Medicaid for cancer treatment. And she is on for the duration of her cancer treatment. Since we started that program way back in 2001, right now we have over 700 women actively on the program getting cancer treatment. These are women that would not been able to afford cancer treatment without this program, which means they probably would not have gotten treatment. One big thing in this program is there are about 200 women who are 45 years old or less that actually have breast cancer. So we do see a fair number of younger women now with breast cancer. And that's why I think it's really important for women that if they feel there's something different with their breast and they fall with our criteria, that yes, we definitely would see them for diagnostics.
Okay. So so I'm just trying to, like, if I was kind of an individual hearing this and I didn't know that this was available, where would I go? Obviously, I'm not going to the Department of Health and Human Service. I'm not going to go to
No,
Lansing.
no.
Would you talk to your doctor, or how would that
Well,
go
you
about?
may. You may.
Okay.
We contract with we call them local agencies, and there's 15 of them across the state. 14 are health departments, but the majority of
Okay.
health departments, I think, may have known about our program. But we have an 800 number that would probably be good for people to call, and it's 844. And I can give you an easy way to remember it. It's the letter I, got, GOT, screened, and the first three letters are screened, SCR. And it comes
Okay.
out to 844-446-8727. And our staff here monitor that phone number, and any questions a woman has about the program, will determine if she's eligible and then refer her to the closest agency. In
Okay.
addition, we have a website. So if women want to go to michigan.gov/BC3NP, and that's sort of our breast and cervical cancer control navigation program. And BC3NP is just a shortened version because the other one is such a mouthful.
Yeah.
They can get information on our program there. And also with that, we have you can email us, bc3np@michigan.gov. And then the latest thing we have, which we're very excited about, is we are part now of My Bridges in Michigan. And if people don't know about My Bridges, it is a system in Michigan that actually is a portal system that has all programs that people could be all services people could probably eligible on within the state. So if a woman goes on My Bridges, it will go ahead and do like a background algorithm based on the information she puts in. And if she's eligible for our program, it'll ask her if she wants to be referred. So it'll refer her also to our program. So we have a wide variety of ways that she can get that information.
Yeah, that's great. So, okay, for that phone number, was that planned on purpose that I got screened with the first three letters?
I came up with
okay.
it.
Okay. I was going to say, was that a coincidence or did we?
No, because when you're talking to people and they think, okay, let me write this down. You go, well, if I got screened, then it's easier to remember. So
yeah, easy. Yep. And then just end where the phone number would end for screen. So, okay, well, wonderful. Okay. So that is very helpful so that people to know where to go, because to let people know that this exists for some people and then where to go to kind of see. And so I think you touched on this already, but either those phone numbers or the website that you kind of described, that they would find out there whether they're eligible for these free screenings and anything else. Okay, great.
Yes, our eligibility is in those sites as well as referrals to all our agencies.
Okay, great. And so, Robin, I'll kind of direct this at you, but EJ might have a little bit more insight as well. But what are some of the challenges that you would say that your department or kind of do you call them sections within the department? Because I think of the Department of Health and Human Services and then departments within the department. How do you guys word it?
Well, if you wanted to drill down and go through all the layers, we're in the Public Health Administration, the Bureau of Health and Wellness, the Division of Chronic Disease and Injury Control, and then the cancer section. So there's all the layers there. But when you get to it, we are in the cancer section, and we are called the Services Coordination Unit because we deliver direct services. I mentioned the breast and cervical program, Wise Women in Colorectal Cancer. Unfortunately, we don't do direct service colorectal cancer program anymore because the funding changed on that we got from CDC. But we do offer direct services for breast and cervical and Wise Women. But yeah, I think the difficulty is just getting the word to the right people. There was a time when the program was screening, 30,000 women a year. And then when the Affordable Care Act came along, a lot of those women were eligible for Medicaid. And I think that's great. we're very happy that they have Medicaid. There are still a lot of women who are eligible for the program, and it's a matter of us finding them and different ways of doing that. EJ mentioned the My Bridges. I think that's wonderful. That just went live just a few weeks ago, so we're still waiting to see the impact of that. We've got the something called My Resident Outreach, which allows us to send brief text messages to women who are hopefully eligible for the program. It's the women who are in the My Bridges system. And we've done that once or twice during Breast Cancer Month. And so that's one way to get the word out. But mainly, it's word of mouth. It's putting up flyers in the health department and having our providers out there have flyers up, and just having the providers know. I mean, when I say getting the word to the right people, it's not just the women who are eligible. It's also the people who provide the services, the radiologists, the OBGYN doctors, letting them know about it. So when they have a woman who's worried about being able to afford the screening services she's getting, they can say, hey, we got this great program. We'll hook you up with them. So in doing things like this, we're just hoping to get the word out to more and more people so that people will know about the breast and cervical program. I call it there for sure, but
yeah, I think EJ said the whole thing, right? Then we understand why it's shortened. So kind of the phone number and the website that EJ was talking about earlier, would that be a place that providers could go if providers had questions? Or okay, there's kind of a great.
Mainly the website. I think that if they call the number, they we would certainly return their call and talk to them. But if they just wanted to get information, they could go to the website, and there are there's a section in there, I believe, for providers who have questions about it. And then for the women who are calling, there is a section with location, and there's a map. And so I believe the map will just automatically determine what county they're in and go straight there. But if not, they can click on their county, and it will give them information about who to contact in their county.
Okay, wonderful. Well, I didn't have any other specific questions, but was there anything that came up while we were talking that either one of you would like to add? Or I know you're both very busy. I don't want to keep you too long because it is October and we have a lot going on, I think all of us. But anything else that you guys wanted to add? If not, that's okay.
Well, I just appreciate you inviting us on here so that we can talk about it. I know I've known EJ for a long time now, and she is very passionate about this program and will help everyone that she can. And I'm passionate about it too, but I'm just a little more low key, I guess. But we're happy for the chance to be able to come on. We're always happy to talk about the program. And the Wise Women program is another program we have for women who are in the breast and cervical cancer control navigation program. And the Wise Women program is not available statewide, but it's in certain areas of the state and provides cardiovascular health screenings. So if you go to the website, you can also find the Wise Women site, and there's another map there that will tell you if it fits available in your area.
Great. Thank you. Yeah, sometimes I just don't know some of the questions to ask. So I appreciate you adding that. So, because I hadn't heard about that one. So, all right, EJ, can you give us the phone number and the website one more time for those listening?
I sure can. Yep. It's 844-I-GOT-SCREENED, in the first three letters, SCR. And our website, michigan.gov/BC3NP. But if they Google the Michigan Breast and Cervical Program, they will eventually get there.
Okay, wonderful, wonderful. All right. Well, thank you again so much. I really appreciate it. Anything that we can do to help get the word out to those people who can benefit from this. And thank you both for the work that you do within the department but for all of us in the state of Michigan. I know working in a department can sometimes be a thankless job. So hopefully I can say thank you for all those people you guys help around the state of Michigan. So
thank you.
Thank you.
We appreciate it. Thank you very much.
All right. Well, until next time, I'll talk to you guys later. Thank you.
Yep.
All right.
Bye-bye.
Thanks.
Bye.
Thank you.